Hey beauties, and welcome back to Aesthetic Chat with Kiki. I'm your host Kiana Gamble, and I'm excited to have this next guest on for the SD Mini Series that we're doing here on Aesthetic Chat with Kiki. This next guest is an acne expert. Her name is Lucy Greene, so I hope you all enjoy. Welcome, Lucy. So I do want to start out by having you share, your journey into aesthetics and what that looked like.
Okay, awesome. Yeah. So I was in college struggling with terrible acne, which I think a lot of acne specialists have a similar story. But I was obsessed with my own acne, and I decided to quit my fine arts degree and I went right into aesthetics school, which at the time I didn't even know that there was such thing as facials. I had never had one. I truly was just going in because I was so interested in skincare. So I went into aesthetics school, and as soon as I got out, I started just working at salon spas, and always my focus was acne, even though I'd kind of do all things aesthetics, as you do starting out. But I got my foot into a plastic surgeon's office, and that's where I met Raquel, and we worked together for 10 years. And during that time, I sought out anything acne. I did so many certifications, read so many books, and I just try to apply everything that I was learning to the clients that I was seeing in the treatment room. And so it's just evolved since then. And still to this day, I'm obsessed with helping people treat their acne. And I literally learn something new each year. It's just constantly so many variables that are in the mix with acne. And it's just so fun to learn about those and then apply them to just how you help your clients.
That's amazing. So it sounds like you've been doing aesthetics over 10 years.
Yeah, I've been an esthetician for 13 years now.
Okay, very cool. And then, so you and Raquel, so I don't know if for those of you listening, Raquel Frisella is one of my guests on, she was one of my very first guests, season 1 of the podcast. But she reached out to me and was like, you have to talk to Lucy. So that's how we got connected. But that's super cool that you guys met working for the same plastic surgeon, and then now you currently work at Raquel Aesthetics, correct?
Yeah. So basically, we just hit it off as soon as we started working together, and we shared very similar clients. People would go to her for injections, laser treatments, and then I would see them for facials. And you could just tell we had, once you start working with another provider, the same people who see you, you realize there's a reason for that. And so we just were very like-minded with just aesthetics in general. And so as I knew she would go out on her own forever. So 5 years ago, I was like, girl, if you start your own practice, I would love to come with you. And so she hired me to lead the aesthetics department and also take over and build the acne clinic of Raquel Aesthetics and RFA Skincare. So it's been awesome.
Very cool. So were you an integral part of helping create that skincare line and really, it sounds like, adapting it to acne patients?
Yeah, for sure. So what's really interesting, I don't think a lot of people know this, but Raquel and I would do online consultations, our own little thing outside of the office. And we would basically use all of these different kinds of products. So when we had the chance to develop RFA skincare, I'm not sure if you have experienced this, but when there's different product lines in your practice, you see gaps that you're missing, or you kind of just see commonalities between the products that people like and what they don't like. And so we got to really dive in and curate this line based on client feedback, essentially. So with the acne portion, I was able to kind of find what I wanted based on what I've learned in the past with other product lines, active ingredients that I wanted to use. And yeah, I basically got to choose products, test them out. We trialed them for so long before we would choose these SKUs. So yeah, we love RFA. Every single product that we have in that line, we personally use or our clients have, and we really don't carry anything that we don't love.
I love that. I think that that's super cool. I mean, the point that you did make, absolutely. There, you kind of pick and choose from the multiple medical grade skincare lines out there, and you definitely have your favorites here, your favorites there, and then you see a gap where one line can't meet the needs expectations of your clients versus another. So I think that's super cool. So with Raquel Aesthetics, are you guys only RFA skincare then? Are you only, for you personally too, are you only on RFA products or like a mix of RFA and like pharmaceutical?
Yeah, so our RFA skincare line is a pharmaceutical brand. So we kind of use a mix of different manufacturers, and we don't use anything in our practice other than RFA skincare.
Okay, so you guys aren't doing any prescriptions, tretinoin, anything like that?
No, so we have basically like potent retinols and retinoic acid, but we don't really use any we don't write prescriptions. Raquel sometimes can for special situations, but we have found that sometimes prescriptions can be so harsh, and we really preach just like a healthy barrier, especially with active ingredients, and we really like to acclimate their skin and be able to grow them into different products and go to higher strengths instead of just like right away getting them a prescription topical.
Gotcha. So for the esthetician that, has maybe that similar drive to get into aesthetics, they do have acne, they struggled with acne for many years, and they want to help other people, feel their best, look their best, really dive into skin health. What do you say to the person that was, you 13 years ago?
I would say really be kind of a self-starter with your education. Don't rely on your place of work to give you those opportunities. Try to take them on for yourself, because I was in situations where we were provided education with the skincare brands that we had already there, or equipment that we were using, but outside of that, not too much. And so I would tell that baby Esty to read every book you can, take every course you can, try to invest in yourself, and don't wait for someone else to do that. And really enjoy just that process of being new and learning. Like, I still try to go into my treatment room with kind of that like student mentality. You really want to always be learning. I call it ATT, assessing, treating, and touching. Being with those clients, like, estheticians are just so freaking valuable in an aesthetic office, because we are with clients for usually a minimum of an hour, and we get to watch their skin for that entire hour, testing products on them, seeing if they're responding well, if they're responding not. We are just like collecting information for that entire hour. And so for those baby Esties, like, don't wish away the newness of being an esthetician. You really want to just soak all that time up, because it's going to make you an awesome seasoned esthetician down the road.
Great advice. And then I do want to ask you, so I've spoke to a few other estheticians on this series already, and kind of the going consensus is true esthetician school does not prepare you for really being in the treatment room, really all the extra learning. So, when you say read all those books, pretty much be a sponge and learn absolutely everything you can, is that because really that schooling is just so broad that you don't get obviously all the things that you need to be successful?
I would definitely agree with that. Aesthetic school is like a year-long training for state boards, and state boards is really just like following sanitary like protocols. It's all about being able to touch people without like spreading bacteria, creating infection, things like that. It's basically like just a way to make sure everyone is qualified to touch someone. But when it comes to like true knowledge on skin, you really just like scratch the surface. So it's really like it's like a stepping stone into like the potential of what you can learn. So yes, I would totally agree with the other estheticians who are saying that, because once you go through that schooling, you realize like, okay, this was not quite what I expected. And that's why I always tell like the younger estheticians are the ones fresh out of school, like this is just the beginning of like your curriculum. You should be going out and seeking any additional education that you can, and touching people too. Like you just have to like start where you can. I have some estheticians who like are waiting for that perfect job, and that's just not possible. You have to gain experience by actually being in the treatment room and touching, whether that's at Face and Body or, you know, like just a small salon spa. Don't ever like, you know, poo-poo those type of jobs, because those you can still learn a lot just by touching and seeing clients, regardless of where you're at.
I think that's great advice because, you know, 13 years ago when you had started out in plastics, I think that especially someone that, you know, wants to really deep dive into the skin, whether that be in a plastic situation or a derm rotation or something like that, I think that those are definitely harder to come by. So it sounds like kind of your advice would be to kind of take a job, learn on the job, and then you can always bump up into kind of either that dream job, goal, or where you want to be. But is that kind of the case where, I mean, especially with even nurse injectors, it's pretty impossible to really start like right in with the plastics or, you know, right in with the derm. So is that kind of what you're seeing as well?
Yeah, it's very similar. I feel like, and you know, even just going back to what you were saying about people wanting to be like in a med spa plastics office, I know so many solo estheticians who treat and transform skin without being under a medical director. So I never want people to think like that's the end all be all, or like the best esthetician career is being under a physician. Because I see so many other estheticians thriving and are so happy even being alone with the tools that they have. So, but if you do want to be in more of a medical setting, yes, you want to be taking any job you can, getting any experience so that when that opportunity comes to where you can apply or interview at a med spa, you have experience. Any experience is better than just waiting for that job to appear and then you have nothing under your belt. Like that's just, it's a fail, you know? So you don't want to pass up opportunities to get into the treatment room. If that's not where you see yourself in 2 to 3, 4 or 5 years, like don't worry. Like you always have time to grow and seek out those offices that you really desire to be in. Set like little goals is what I always suggest, because that's what I would do. As soon as I got out of aesthetic school, I was like, man, I want to be as busy as the hairstylist that I'm working with, because I was in more of like a salon spa. And my second job, I was just as busy as any hairstylist. And then that just like grows. And then I got into the plastics office and I was working pretty much like 6 days a week, full days, back to back to back. And, you know, now that I'm 13 years into my aesthetics career, now it's more like quality over quantity. So it's funny how things change, where I wanted to be as busy as I could, making as much money as I could, seeing as many people as I could. Now I'm like tailoring it to how can I help people in the best way, whether that's seeing 5 people or seeing 12 people in a day.
Your journey has evolved. You started out wanting to be like high quantity, and now you're like transitioning into high quality, which I think is really, really cool. So I do kind of want to transition now into all things acne. I think that you have lots of things to teach me as well. So I want you first to kind of discuss biggest misconceptions when it comes to acne, and then we can kind of let you take the conversation wherever you want to go.
Yeah, no, I'd love to. Okay, so the biggest misconception with acne, and even clients who I've been working with for a while who have been told this, and I preach this to them 1,000 times, it's still hard to get this out of their brain, because I think as an American culture, we have just for so long believed that it's more of a topical issue. And acne truly is, regardless if it's within your genetic makeup or if it's something that you're experiencing as you approach your 20s and 30s, it is a symptom of inflammation in the body. Or in other words, like something's off inside of you when it comes to your health, and it is flaring up this acne condition that you're seeing on your skin. I feel like that is like the number one misconception, is that it's not intrinsic and it's more topical, but it really is intrinsic. Have you had any acne specialists on your podcast yet?
No, you're the first one.
Oh, I'm so excited. Okay,
yeah.
cool. So basically when clients reach out to me, that's like the very first thing I tell them. I say, okay, I want to help you. I'm so sorry you're struggling with your skin. But before we get into product recommendations, I like to first and foremost just tell them that you're experiencing acne because of something going on inside. And while we prescribe you these RFA products, we're also going to be doing a deep dive into what could be going on inside that is flaring this condition up. And so once you kind of set that standard right there, I like to do that because I don't want clients who are on this journey who really just expect skincare to do it all. It's going to do, I always say it's like the 80-20 rule, like 80% is going to be lifestyle changes. 20% is going to be the topical component, because that is really just going to help treat the symptom of acne. But you really do have to work on what's going on inside to have long-term clear skin. So yeah, that's usually what I start with consultations. Really, it's kind of crazy these days. Majority of my clientele are women who have been on birth control for decades and are getting off to try starting a family, or it's clients who are, well, basically they've had a child, they're starting their family, and after childbirth, their hormones are just out of whack. And usually the commonality is that most of these women have been on some type of synthetic form of hormones, or their diet is crap. And I feel like that's just really hard because I feel like our society is just surrounded by like quick food.
And quick fixes, 100%.
Yeah. Quick food, quick fixes. There's like a coffee shop around every corner. Everything's sweetened to the max. Like, we're such a spoiled society. The older I get, I think like, gosh, we are all just so spoiled. Like, everything tastes good. Everything's fast. Everything's right there. Even with like our computers and our phones, like we have so much information right there. We don't even have to think about something, like our phone just tells us. And I feel like when it comes to acne, it's similar. Like, we are just like pumping our bodies full of stuff that creates inflammation. And so whether it's hormones, which hormones is like, that right there is huge, because I don't think people realize how food is connected to hormones. I think people think like reproductive hormones is like it, but we have insulin, which is a hormone. We have cortisol, which is a hormone. All of these things, which caffeine affects your cortisol. Cortisol affects your stress response in your body, which creates inflammation. And also caffeine and cortisol impact your testosterone, which testosterone impacts our sebum production. So like, without like overwhelming people, I always tell them like, basically things you're eating impact your hormones. Your hormones impact your oil production. So it exacerbates this acne issue, because oil, the more oil we have produced, the more bacteria grows, and that's where you get a pustule or a papule. So it's like all connected, and it can be really overwhelming to someone, especially whenever they think like, well, acne just like happened out of nowhere. Or what I love is when clients are like, I started using this product that I saw on TikTok, and now ever since I've just had terrible acne. Or I'll hear about facials too. Like, I went and saw this esthetician and I got a hydrofacial, and now I have cystic acne. It's like, okay, it's just terrible timing that this all happened at once, but it's basically like a ticking time bomb. Like it was going to happen regardless if you had that facial or if you tried that product. A lot of times what they're experiencing is purging, which purging is where there's basically acne in the skin that you're shuffling up with cell turnover. And that's when they start to see the acne exasperated, and then they want to blame it on whatever they either are using or the facial that they just did.
It really sounds like a holistic approach in the way that you tackle acne. What does that, is it through like a lifestyle questionnaire? Like, how are you really diving into that root cause for each individual person? Just because, like you're saying, it's like multifactorial and like everything is interconnected.
Yeah, it's really overwhelming. Like, even as an esthetician, that's kind of what I was saying earlier about how like I'm constantly learning. It's because I went into aesthetics for skincare to treat acne. And then lo and behold, we find out that, it's like a health issue. And sometimes I feel like super underqualified to be telling people like, hey, you need to like change your lifestyle around. So that's where constant education is so important. Like to this day, like I'm still just like discovering things, or like I'll figure out like, okay, what I believed last year that has evolved to this. So yeah, it's more of a holistic approach. And what I do is what you had just said, a questionnaire. If you do take acne certification courses, they give you kind of examples, which have been super helpful because I've been able to build on that. But yeah, you start out with a questionnaire and some just real simple questions. You can start to realize like there's kind of an underlying issue. So I always ask, are you on any medication? I always ask, how much sleep do you get on average per night? How many hours a week do you work? And is your downtime from work busy? Like how busy is your calendar? Do you drink caffeine? If so, what type and how many, like glasses or cups a day? I also ask, do you drink dairy or eat dairy? Do you take supplements? All of those things, you start to really see like this picture of someone. Also, if you're pregnant, not pregnant, oh gosh, like so many questions. I mean, I'm surprised people fill out my questionnaire because it's so long and lengthy, but it is really important to know. And then also, I ask them what they're using skincare wise, because sometimes even just seeing that paired with their lifestyle, you realize very quickly, okay, I can help that person. Because if they're using like just cleanser, moisturizer and nothing else, and maybe like say their lifestyle and health seems okay, then you're like, oh, this is going to be great. Just a little bit of skincare and a customized regimen. They're probably going to be so happy. It's more difficult when people have like a pretty good regimen. As soon as I see one of those come through where they're on good products, because I've used all product lines and I can basically recognize a good regimen. And then their health is shit. Whereas like, I'm sorry, can I cuss on this podcast? I'm sorry.
Yeah, you're totally fine.
Oh, okay. Sorry, I just got nervous for a second. I was like, oops. But yeah, when their regimen's really good and they're on medication, they're on tons of supplements, they have a very stressful job, their sleep is not great, all of those things, I'm like, okay, this is going to be, kind of a challenge, and like a good challenge. Basically, I just tell them all of the things that they need to know. And because it's not within my scope to say like, hey, you may have PCOS or you may have something wrong with your gut, I just give them all the information to read so that they can start pinpointing out things that ring true to them. Because most people who are struggling with acne, they want to figure out what's going on, especially once all these things start connecting. Like as soon as I tell them like, hey, how many times like do you go, like what are your bowel movements like? Do you have tummy issues? Or are your periods regular? Once we start talking about those things and things start clicking, like, oh yeah, I have inconsistent periods. I always thought that maybe my acne was related to hormones, but now like me saying it, it starts to just like light bulbs start to go off. And then they have the information that they need to start looking into. I would suggest like a functional med doctor or a nutritionist who can like really look through their diet, because I can, but I'm also one of those people who are like, okay, there's others who are better at this. And so I'm going to refer you out so I can really just focus on kind of the more simple things when it comes to their health, and then really focus on their regimen.
I love that you highlighted your scope, especially, and because I think that that's important too. Like, I think that you just even saying, hey, like, I could do this, but I know that there are other professionals out there that are highly trained or, better at this. I'm going to refer you out. I think that that's a huge thing. That was kind of my question too, like that you touched on a little bit, was how receptive are people? Are you kind of one of their last resorts? They feel like they've tried everything, and so they're really, really open to things. Or do you have a few people that are kind of just like, I want the topical thing, like whatever you're like, it just sounds like too much work, and then they just kind of move on?
Yeah, I have a little bit of both. I try to put everything up front so that they can determine if they're going to be a candidate for what I call like my acne boot camp program. Because no hard feelings, like it's a lot of work, and some people aren't quite ready to go on that journey. It's almost like, quitting alcohol or something like that. I mean, it's basically like a huge lifestyle change. And so I like to front load that. I give them all the goods, all the information that they need so that they can just see like, is this going to be worth my time or not? Am I ready? Am I not? And I appreciate that. And I'm sure they do too, because we don't want to waste each other's time. But I get a lot of people who are like, or they'll pretend like they're going to walk the walk with the lifestyle stuff and really just start with the regimen. And I'm fine with that. I always say like, hey, my guidance is free, which is one of the reasons why I don't charge for my time, is because they really have to be putting in the effort. I can guide them, but it's up to them to make those changes. And so if you want to kind of like ignore that aspect of treating acne and just do the topical and just see where it gets you, like, I'm fine with that. I told you, like the lifestyle is a huge part of it, but like, if you're not ready to do that and you just want to start with topical products, like that's fine with me. So yeah, I get a lot. I would say like majority of people are desperate and they've really like exhausted all avenues, and then they're ready to like talk to some random stranger on the internet. I mean, like if you really think about it, like these people are sending in vulnerable photos of their skin to me. They've never met me. They just have seen me on Instagram. So like right there, I feel like you can kind of gauge that they're desperate. And then I get a lot of referrals too. I mean, I think people are really surprised that like I'm a normal person on the other end of this email. And like, it's so fun to see them grow. Like I usually become like their skincare person because I've been with them while they got off birth control, they got pregnant, they delivered, nursed, stopped nursing, like all of those like little seasons of life. They moved, they got married, like things like that. Like I'm with them along the way. I always laugh, like I'm usually the first person that people tell if they're pregnant because they want to make sure their skincare is safe to use. And it's so funny that like I'm their person that they're telling first before their family.
Oh, like, I love it.
Yeah, but literally I'm honored. Like, I'm like, it's just so sweet. I'm still this like what was once a stranger on the internet.
That's so cool, though. I think that the relationship building aspect of this specialty is so fun because, yeah, you get to see people through different walks of life and you get to build those relationships and just see them through good things, bad things, all those things. So I think that that's really, really cool. I kind of want you to talk a little bit about, well, a few questions here. So one of them being, it sounds like you do a lot of online consultations and you manage a lot of people from all over. How does that look in terms of, getting them in for in-person treatments with estheticians? Do you have like a network across the country to refer people to? Or how do you know that, I don't know. I think it would be a little bit challenging to manage people fully online if they weren't, able to come see you?
Totally. So like with online consultations, it originated for me even before the pandemic, like before it was kind of like a standard in the industry. I started doing online consultations because when I became more educated in acne, you realize quickly that it's all home care and lifestyle changes, and those things they can do right away at home without having to come and see you in the office. So I was so booked out and busy with like just my regular clients in the office that weren't acne, that a part of me was just sad. Like I was so passionate about acne, but I wasn't doing it on the day-to-day basis. So I started with the online stuff, and when they're virtual and not local, what I always have them do is Google basically like med spas. And I always like suggest acne specialist med spas, just really highly rated, reputable places nearby. And I truly just have them send me over links, and I go through their spa menu and kind of help guide them in that way. And then, yes, with the network of acne specialists, because once you start to do courses, usually they have Facebook groups and things like that. And you start to build relationships with these other estheticians that treat acne too. So sometimes you'll just hop on one of those forums and just type in a zip code, and you can kind of see who is available and around. So that's what I do for like non-local. But I will say, like in St. Louis, where our office is, we treat acne basically the same way we would virtual. Like we have them start online regardless. They don't come in for in-person consultations. We have them send over their photos and fill out the consultation form just like they would if they were not local. And then from there, we do like a global assessment where we talk about the skincare part, the lifestyle things that they need to do, pretty much give them all the handouts that they would if they were in office, but in more of a PDF so that they have those. And then I always have my clients start off with a series of facials that include mild chemical peels with no downtime. And I have them do those bi-weekly or every 4 weeks whichever they can afford. And then I have a team of estheticians under me who all have trained under myself and who are very skilled. And they will facilitate the facials if they can't get in with me personally, because unfortunately I am still just like so booked out and I can't see everyone.
Mm-hmm. Well, that's a good problem to have for sure. So my question for you would be for the person listening that is struggling with acne and they're like, oh my gosh, I want to do a virtual consult with Lucy or with someone on her team. What would you say to that person that, is more budget conscious and they're like, I really cannot make a monthly chemical peel happen, or I'm concerned about the cost of potentially the products?
Yeah, I love that you bring that up because we always laugh in the office. Like I have a hard time upselling anything because I, in my heart, just feel like a poor like person who shops, like at Dollar Tree, just making it by, because that's really how I grew up. We were super middle class. And so like it can be really expensive, and I empathize with the people who have to kind of budget with skincare. So what I do is if someone wanted to reach out and they're really struggling with their acne, but they only have a certain budget, I actually have a blog on budget friendly alternatives. So I still go through the same consultation process. They still get all of that good information on lifestyle and diet, which it's free. They take it, and like right there is so valuable. And then I give them their product recommendations. And then at the very end, I say, if you can't afford all of these or any of these, please click here. And it links them to my blog. And then that has like drugstore dupes, products that they can get online that they can mimic the same regimen with. So I really don't turn away anyone. I truly empathize with everyone because scarring is happening every second that goes on with acne. So it's like really, we're trying to just prevent scarring from happening. If you can just start on something that will kind of mimic this program, and then start with what you can control at home, which is everything you're putting in your mouth, you can start seeing a difference and you'll get somewhere. So yeah, I hope that answers your question. Basically, go to the consultation form. You can go to Lucy Hates Acne. You can even reach out to me on Instagram. And then I just have a questionnaire, and it's no obligation. Really, it's basically like a gift of information for you. And if you want to participate, you can, or you can take it and run. Like it's all there for them.
That's amazing. So I do want you to touch a little bit on, say you have cleared up acne for an individual, but they do have some significant scarring. What are you guys doing in the clinic once you're trying to manage those scars?
So we always joke, you want to throw the kitchen sink at scarring, because it happens so deep in the dermis that there are only certain things that can impact that area to help improve atrophic scarring. So what we do at our office, and there's so many different treatments out there, but what we have found is we start with microneedling. So we use skin pen, and that helps to break up the scar tissue that's happening. Do a series of microneedling if you can. And then we do what's called cool peel, which is a CO2 laser, but has different levels, and that's an ablative laser. So if you compare needling, a series of needling, and then do, as you know, whatever you can afford in terms of lasers, do a laser treatment. And then we also like chemical peels too. And then even after all of that, we sometimes will do hyaluronic fillers. Raquel's great at that, and so are other nurses who work under her. And that, I feel like, is like, it's so worth the investment, because it basically is like Fixodent. It pops out some of those like really noticeable atrophy areas from acne. Clients usually are really, really happy with that too. So there's so many things you can do for acne scars in the med spa world, but really the goal is that any is better than none. So like, even if you can't afford a series of microneedling, if you can at least do one or two and just try to be consistently doing treatments, whether it's chemical peels, microneedling, a laser, or just like getting really good facials, you're going to see an improvement over time. But you can't ever get rid of atrophic scars altogether, but you can do all of those treatments that I just mentioned to help soften, smooth them out. You know, doing it as soon as you can is better than waiting, because we lose so much volume as we age. And so while you still have all that good collagen, you want to be stimulating it as soon as you can, as soon as you clear up.
Great advice. With the, with your microneedling series, ideally, if it was a perfect world, how many would you have an individual do? How frequently would you have them do them? And then are you doing any topical application of like exosomes, PRP, anything like that?
Yeah. So in a perfect world, if money was not an issue, I would have them do like 4 to 6 microneedlings. And we love exosomes, and I love exosomes. I have seen it firsthand, like transform people's treatments, especially when they use them with lasers too. They basically stimulate like 6 times the amount of collagen than microneedling can just alone. So if they can afford to add on exosomes, I always suggest that too. And then there's the series of treatments. I always say do about 3 to 4 weeks apart.
Perfect. Yes, I think you answered all of my questions like amazing. So is there anything else that you'd like to leave with the listeners, acne related, starting out as a new aesthetic professional, really any other pearls that you would like to leave?
Yeah. Oh my gosh, so many. So if you're struggling with acne, do not hesitate to reach out to any acne specialist who's offering their services online. Really, I feel like all acne specialists are like angels from the heavens above, because they're basically sacrificing their own emotional state to help you clear up, because acne is such a discouraging process. When you're working with an esthetician who treats acne, all we hear is bad news all day, because we didn't really get to talk about this much, but you purge before you clear. Everybody does. So you get worse before better. And that first 90 days of working with someone, all you hear is just discouragement because who wants to get worse before better? So every acne specialist out there is an angel sent from above. So reach out to them. They are so willing to help you, whether it's myself or someone else. And then if you're a baby SD, really, I just try to preach this to all of our new hires and just everyone online is, ignore Instagram, be lasered focused on what you want to do and what you see yourself doing in your career. And do not pass by any opportunity to get hands-on and in the treatment room. Take every opportunity, invest in yourself. Don't wait for someone else to do it. Nobody owns your education like you do.
Such great advice. Thank you again, Lucy. Finally, tell people where they can find you, your blog, the questionnaire, all the things.
LucyHatesAcne.com. If you go there, you'll see my questionnaire and my Learn Center, which has so much information on acne. And then on Instagram, I'm Lucy Hates Acne, and rfaskincare.com or RFA Skincare on Instagram. Just reach out, say hi. Yeah, and I hope to talk with everyone.
Thank you, Lucy, for coming on Aesthetic Chat with Kiki. I learned a lot about acne, and honestly, I kind of want to take your questionnaire. But again, thank you so much for your time. You guys kind of know the drill. To find the podcast, you can find it on all streaming platforms, including Spotify, Apple Podcasts, and YouTube. The podcast Instagram is at aesthetic.chatwithkiki. My Instagram is at aestheticnurse.kiki. Until next time, beauties. Bye.